Now, there's a divide. There's a divide between those Africans in the diaspora, those of yesterday, and those of the day before. To make progress within ourselves in the diaspora and also in the continent, that divide has to be bridged. What am I saying? The deal is that right now, all of us, most of us in this room, we're looking up. Okay? But we're not talking alike. We're not talking alike. And when we therefore come across each other, and that language barrier comes in, oh, okay, let's do this. And then at that point, we begin to kind of do the distance with ourselves. Now, this is not a matter that will be resolved here. It has to be resolved in national organizations and international organizations that we will try to approach in the future. Okay. Now, also, we would like, as I said here, we see ourselves as strangers because of the difference in accent and cultural backgrounds. Okay? The African continent, which we call the motherland, has never made an attempt or plan to attract back to African diaspora. How many African countries have budget for African diaspora, other than just their nationality? So, we can blame each other one way or the other, that we have to let it blame where it is supposed to be at. I think the African continent itself, the African nation itself, they need to begin to make efforts to put budgets together to bring African diaspora, not just their own nationalities, but African diaspora, have a budget for them, so that they can begin to come, to get established in Africa, to build roads. We have doctors. We have trades. I mean, right now, even in this room right now, we have a good expert on travels, who can connect you to anywhere in Africa. Let me see your hand, Mr. Look at that there. So, there are many things that we can do for ourselves. But, right now, what the African Americans know about Africa is what the media tell them. Right. And the media is not good. It is not. And on the show, look, there was a time that they were showing this very pathetic image on the TV about this African kid that was, he's hungry and he's been beaten by malaria. It was so terrible with tears. And this was photo ops. That's what they see. They hear about all the fightings, all the wrong things. So it is we, and I blame nobody. It is we that need to do something. And that's why we are here. And that's what this organization is, why it's called a Global African Diaspora Development Network. It's a long thing, but meaningful. And we mean everything. It's African, it's global, okay, and it's for development. And for the network. Why are we doing this? We are doing this, seriously, not just for those of us in this room. No. We are doing this because our grandchildren and others to come. That's what we do. We cannot continue like this, guys. Whereby anywhere in the world they go, they look at it. So, but until we fix ourselves, and until we also fix the mother, we'll continue to just, many people come to do this. So, guys, we're not activists. No. All we want to do is have a change of mindset. All we want to do is also to let people understand that we can do things, we can manage ourselves. So we're praying and hoping that we can go a long way by agreeing to do things together and always thinking about the legacy for our children. Most of the places, why we're the way we are, because most of the people out there, they think about their belly and their pockets. We need to live a life of legacy. We need to live a life of tomorrow. And secondly, coming back to
a lot of people communicate, but very few people connect. And so we are connecting our resources, our intellect, and all of our ideas. And our goal is to empower not only Africans, but Africans in the diaspora. So we want to do that. This is our first time doing this. Thank you so much for being here.
Africa too, because I have never lived in Africa. But I've been there 3 or 4 times to talk to distance educators at the African Council of Distance Education, and been editing a journal that we have special issues on distance education in Africa. It's a really happening place when it comes to solving problems that you cannot solve the old way. And you'll see in some of the data that I show you that you know, the opportunities to build universities, to build colleges, training or trades colleges, for the demand that's there and the resources there, to do it the old way is not going to happen. We will not build the number of universities that we have in North America per capita. But that doesn't mean that people are going to go uneducated. And I think you'll see from some of these slides that people all over the world are leapfrogging over the physical reality of a campus. And you remember, okay, so what is distance education? It's access to learning where the source of the information and the learners are separated by time or distance. So it's the same kind of education, the same kind of outcomes, the same kind of, sometimes the same kind of teacher relationship, but sometimes with vastly different relationships. And it usually involves working towards a degree or a certificate. But I think you're seeing that now with informal learning, where people have webinars, where people go and watch YouTube videos, that we're starting to see learning get away from teaching at a distance through newspapers. Then we went into radio and television, and just recently we've gotten into internet-based distance education. So it's not something new, it's something we've had around for a long time. But now, if you look at the types of distance education, here's our regular education, just the normal face-to-face classroom. And then you get where you're transporting that classroom to students in their homes, or maybe in offices or groups like that. But you can also have individual coaching and mentoring, which is a huge opportunity for the diaspora. Sorry, can't pronounce that either. But here's the new one here, is all of the ways to form communities, to have learning communities focused on a topic that are outside of a formal education, with blogs and wikis and chats and threaded discussions. And then you can get the canned content, where you make a lecture, you make a presentation, or you show a game or simulation or whatever, and then you have it streamed over the internet so that people can do self-paced, so they can take it when they want. They don't have to wait till September or January, they can start whenever they want. And finally, just a performance support where the knowledge is encapsulated and on your machine for when you need it. So there's all kinds of new kinds of distance education that are emerging. This is from the University of Zimbabwe, and this is from an African perspective, what they see they will get out of it. And there's always a danger when you import exports to come in, teach your students that, where's the job for me? You know, what has this done for my local community when I'm just importing expertise? And so we always have to watch that and balance the local need plus the expertise that you bring in. But here's what the staff say in Zimbabwe. It'll give them increased enrollment, which will improve the financial viability of their institution. And this is when they're delivering distance education to people outside of the big cities of Zimbabwe. It is important for faculty development. One of the things we know with distance education in North America is that the teachers who teach it, they bring their new knowledge of media use and asynchronous learning, they bring it into the classroom. So it starts you thinking differently about what teaching and learning is all about. Increasing staff income through writing and creating tests, and gives faculty a chance to revive courses where there isn't enough students at any one place. That's a big problem we have in Canada. We have a huge spread out, and so if we can get 2 students from this town and 4 from that town and 6 from here, we can start to build a learning community, and it's been a huge benefit for us. So, in summary, distance education can be affordable, and it's expanding access in Africa and around the globe, but it's not a universal solution to all problems. It can be done very well, or it can be done very poorly. It provides opportunity and incentive for change and innovation in both the public and the private sector. And it can be a powerful tool for increasing the impact of the African diaspora, not only impact in Africa, but within America and within other countries as we start to network and build on values that are important to us. So, thank you very much. And
what I'd like to do is follow up with what Dr. Terry just presented. I'm really glad he went ahead of me and really laid the groundwork. So much of what he said fits into what I did. It's almost telepathic that we didn't even talk about what we were going to do together. But it makes quite a bit of a difference knowing that he led the way and I'm going to follow. Now, I'm going to start this by saying, if you look at these 3 people, the only thing that makes them similar is their ages. And the fact that each of them is probably going to be a billionaire. Well, she already is, he is, and she's getting close. Now, they're in their 30s, which is really, really young. I mean, I couldn't believe this. When I was 30, I was still trying to get it together. But the reason is, the reason I put the slide up there is that this reminds me of Africa. You might say, well, all the hell does that remind me of Africa? Well, these kids did, and their kids, in less than 1 decade, starting from scratch, what people have tried to do in 200 years. Like Dr. Terry said, there's a leapfrog mentality, and these people have leapfrogged over everything that came before and got results. Ms. Cave, she's a mechanical engineer. She came up with a way to get rid of carbon dioxide in climate change to make the planet a little bit better. She's not yet a billionaire, but she's getting close. Elizabeth wrote her first patent at 19. And what she did, she invented a way to take a single drop of blood and run up to 200 tests on it for less than $30. She's going to put the medical laboratories out of business. She already did it. She's worth $5 billion. Mr. Gogo, I hope that's the way you pronounce his name, but it reminds me of Lady Gaga. Mr. Gogo, brilliant guy from Ghana. Elizabeth is from California, she's from Houston. This guy's from Ghana, and he came up with a technology very, very simple, very elegant. He can detect counterfeit drugs in the pharmacy. What you do, when you buy the drug, you take a picture of a scratch-off label on it, hit the go button on your application, and it says in 6 seconds, it's bad or it's good. Imagine that. The reason is this. Okay, what I'm trying to get at is that if these 3 individuals who began life just like the rest of us didn't know anything the day they were born, but they came to a point where within 15 years of their actual learning lives, because they didn't start learning until they were about 12 or 13, they can do this kind of stuff. It means that Africa doesn't have to go through 200 years of trying to go from the Industrial Revolution up to the electronic age. They can leapfrog completely over that system. Now, this is what I call ETSO. These individuals have education, training, skills, and opportunity. Now, a lot of places in Africa, the opportunity is not there, but it is coming. So it has to be something that we get into. Now, look at Africa today. 1.2 billion people, with a GDP ranging from $18,000 in Equatorial Guinea to $240 in Malawi. Malawi's got problems. It's landlocked, not too many people are educated. Guinea is not really that much better as far as the people, but they hit the jackpot. They've got a lot of oil. So that makes the difference. Life expectancy between 50 and 60 years. But what's noticeable in Africa is what I call the youth bulge. Everybody's young, which is good. When you're young, you can work all day and party all night, and then go to work the next day. We all did it. So the youth bulge is a problem in some countries where there are many, what I call political problems. But in Africa, it's a blessing. What the economists and the bankers and the developers have told us is that growth alone is not sufficient. You need more jobs. Not only more jobs, you need better quality of jobs. And the quality has to be technical, professional, supervisory, and managerial. Those three young people on the first slide, they were in the technical area. So the challenges that are present in Africa focus on the people. And there's only one way to make it better is by improving the abilities and the resources that people have available. If you look at the end of this slide, 6% penetration in higher education is not sufficient. The average country has 26%, so there's quite a ways we got to go in Africa to make this happen. Not only that, you have to look at trying to outrun the rest of the world. The population increase in sub-Saharan Africa is going to be 1.2 billion. US 100. Europe is going to lose 50 million people. They are getting older, they don't have as many kids. This is where the growth is going to be. And here's what the workforce looks like. Almost 1 billion new youngsters entering the workforce. 830 million. That's a lot of people in the next 40 years. That's 20 million a year. We saw on the earlier slide, it says 18. But this has to be absorbed, and the only way to do it is by a structural transformation. You can't do it the way we did it. Go through the regular mechanism and hope to get there. Like Dr. Anderson said, you've got to use the tools that he analyzed, looked at, education-wise, and we've got to have productive increases, after which you start following these increases with resources.
My talk this morning is Exo Diaspora Africa. And this is where I'm coming from. My assumption is that appropriately, those of us in diaspora, particularly in healthcare, we have the prerequisite skills. We have education, we have technology, we have the skills, but the opportunities exist in Africa. And so, what I'm going to try to do, probably in the next 45 minutes, is to, first of all, create a case, make a case for why we in the diaspora in medicine have to connect with Africa. First of all, highlighting the state of healthcare in Africa. Are there reasons why potential entrepreneurs will have hesitations or palpitations about investing in Africa? Yes, there are. Corruption, infrastructure, etc., etc. However, even if you take care of that, high costs of diagnostic and surgical services, that brings up the issue of can the populace afford it? That is where the national health insurance policy comes in. If they have a specific health system that guarantees access, regardless of your economic status, that will take care of this problem. But then the one I want to emphasize here is shortage of trained healthcare professionals, because you cannot move all this expertise across the ocean if you don't have individuals that can run it. Maybe the hospital, maybe the MRI machine, or the CT scan. I found, just as I was preparing for this, I found something in one of the Nigerian newspapers. They call it the Nigerian Health Leadership Academy. And I think it's very interesting what these folks are doing. This is the private sector health alliance of Nigeria. And there's another organization called the Health Strategy and Delivery Foundation. Look at what they're doing here. They are partnership with Institute of Health Improvement in Cambridge, Massachusetts, and Duke University. What are they doing? They're trying to train local manpower in Nigeria on health management. And I think this is a very, very visionary move. Because one of the things that happens is that you set up all these hospitals, nice buildings, and you go back there in 6 months because nobody can run it well, it's in shambles. So there's an opportunity here for training manpower. What are the areas of focus of this organization? They are closing capacity gaps in the health sector by focusing on financial management, leadership and organizational development, quality improvement, and population health. There is a Jewish mission, which I think we should take from this. When you started this organization, there were 3 of you, right? I think we should take solace in this statement that it is not your obligation to complete the work, but neither are you free from taking the first initiative. You have taken the first initiative, and the rest of us in this gathering, all of us, and I mean all of us in the diaspora, we are put into circumstances that call out for action, whether they involve poverty, human suffering, etc. These circumstances give us a great chance to justify our gifts, our skills, as doctors, nurses, engineers, whatever we do. That is where I would like to stop. That is my better half.
I'm going to just ignore those people. There are people who are there who are waiting for you. People who are eager. People who are hungry. People who are full of energy. But you've got to look for them. You've got to search them. You've got to be critical of people who are saying yes and no. All you have to do is have your eyes open. That's the key. Keep your eyes open. Look before you leave. If and when you have access to the system, what are the things that must be addressed? What I have here can apply to any part of medicine. We've got to update the knowledge base of people who are practicing medicine, pathology, or whatever in the country. And it must be done in a way in which it can be sustained. Because you are going to go, if you're going to go establish a laboratory, or a diagnostic laboratory or a hospital, you are not going to bring everybody from America who will work in the lab, or who will work in the hospital. So you must have a core of locals who are trained, who are educated. You must have people who can practice, and people who are there are not done. They just don't have the same opportunity as you have. So all you have to do, first you have to do is identify the people who can be trained. And you've got to train them in a way in which they can keep up their competence, their level of competence. Some of us here, when I came to the US in 1986, I came to a department of pathology at the University of Vermont. I had never been in any Western university, any Western medical establishment. I was fresh as you can get from Nigeria. And within 6 months, my chairman called me, said, "Additional, we're wasting your time, you'll be trained." Said, "You'll be trained, you'll be well trained." Said, we're wasting your time by making you go through the various steps, 1 month rotation here, 1 month there, 1 month there. He said, we have to restructure your program. We have to restructure what you do so that it's beneficial to you. not just making you repeat what you have learned. And that was how my program was restructured. I was put in positions where I was supervising residents, I was giving courses to teach in the university. The first time they would bring a foreigner and say, whose accent nobody understands? I remember the first day I went to teach one of the courses. The students were up and down. We don't understand what you are saying. The effect of the presence of a group like this in the health sector must be such that the quality of practice is enhanced. You have to set a standard. And set a standard that everybody wants to emulate. One of the possible effects of setting a standard and getting incorporated in the system is that ultimately there will be room for advocacy, both to private and to government institutions and government policymakers, the various ministries of health. What can you do now before you become a participant on the ground? And maybe a way to actually finding your way to the ground. You've got to get to know the people there. But if you're doing something for them now, when you say you want to come, they say yes. We know you because when you're not going to make money, you came to help us. If when they saw you is when you want to make money, they become suspect of you. It doesn't matter whether you are white or black. If what perception of you is that you are a money maker, people are going to treat you as competition, period. But right now, one of the things that we're doing is that we are putting together faculty. Like for instance, I go every year to West Africa with 5 to 6 faculty from North America and Europe. And we organize conferences for pathologists in the West African region, and sometimes in the East African region. And we have 90 to 100 people, pathologists and trainees, come to those conferences. And we educate them using the same standard. Because one of the things I tell the faculty who come with me is this. When you come with me, when you teach Africans, you teach them the way you teach Americans. No watered down lectures. You say, oh, but they don't have this equipment, I say, I don't care. They don't have it, how do they know that it's important equipment if you don't teach them at the level that it's supposed to be? And so we make sure the lectures are given accurately, correctly, at the appropriate level. The idea is this. Those of us who are academicians in this room, and even those of us who are not academicians, one thing we know is that every year you go to conferences, you get CME. That's how you update your knowledge. Dr. Critchlow was talking about all these .com, and all of these things. Did he know them? Was he taught when he was doing his PhD? This is PhD 20 years ago, when there was no .com. But all he had done was he had kept up with his field. And that's what we all do. We keep up with our field. And many African pathologists, many African physicians are not able to keep up with their field because they can't afford to come to conferences in America or in Europe. Not because they don't want to come, they can't afford it. So for some of them, it will take a whole year's salary to come to America for 2 conferences in a year. So what we need to do is to bring those conferences to them, bring the experts to them. It's cheaper to bring one expert to teach 90 than to bring 90 to come to a conference. So if you make such things regional conferences, you educate them, you bring them up to date, it will even begin to change their practice style, and the standard of practice will improve. And that's important. Because one of the things I tell people is this. I am here in America, North America, but my family is down there in Nigeria. I don't know who of these people I'm teaching will be looking at the biopsy of my mother tomorrow. And if I don't teach him what is correct, what is the level of standard, he will only diagnose what he knows. And one of the things in medicine is this. This is why you have a second opinion in medicine. Your doctor will only diagnose what he knows. Or what he has seen before. If he has not seen it before, and he doesn't know it, he will tell you that it's in your mind.
And Africa itself is part of this struggle. But guess what? The majority portion of Africa has more energy to power the whole world. But why is Africa still in Africa? Why Africa? Well, look at it. Africa is the home to a host of fast-growing businesses. Over the last 10 years, it has done 6 out of the world's 10 fastest-growing economies. While everyone has been focusing on Russia, Brazil, and all that, Africa was busy growing. Okay? The number of middle-class Africans has tripled over the last 10 to 40 years. It's so amazing. So, when you look at it, Africa is one of the few places in the world with increasing number of labor force. Youth, old, mid-adults, or whatever. You find them there. And if you want to really grow your wealth, Africa is a place to be. Because you will make money. If you put sand on the side of the road, people will buy it. Believe me. However, to catch up with the industrial world, Africa needs standard and reliable energy sources so it can grow and drive its economy. It has a lot of potential. Look, the need for development is critical in sub-Saharan area. Why? That's where most of the populations are. I'm going to show you this map. If you put United States, China, India, Europe, East and West Europe, it will still fit into the whole continent of Africa. That's how big Africa is. And it's no brainer to come to find out that the same big continent is the only one lacking in everything, but it has its own energy. And I'll tell you why. Look at the map here. It shows you, it depicts in red using the world map areas representing concentrated slavery in Africa. This is modern day. You still have slavery in Africa. Why? Why? And look at this other map. They clearly depict the fertile agricultural pastoral differences between northern and southern Africa. But then look at the rest of the world. So the fight is not just taking it home to Africa. We are going to rebuild Africa. But Africa cannot be rebuilt by foreigners, by Chinese. It has to be rebuilt by Africans. So if you have a notion that some people are going to come from Europe and they are going to build Africa for you, you are mistaken. Because it's not going to happen. Look at the poor inadequate development of Africa. It can be reflected and best understood by this map. This is the digital imprint. These are the continents or countries of the world where you have internet, Wi-Fi. Look at Africa. Okay? No lights in there. Why? Huh? It's that. All the other continents are leaked. Well leaked. What happened in Africa? It's that. They call us a dark continent. But we are the birth of civilization, science, and technology were developed in Africa. We have complex critical heritage. We have governance, architecture, arts and humanity, energy, minerals, oil and gas. And that's where we're going to start. Okay? I wanted to give a big respect to President Barack Obama when it comes to power in Africa. That was the first time any American president will really truly focus on power in Africa. He took the initiative to start the program, not only the AGOA program, but it's called Power Africa. Electrification of all of Africa. No president in the United States has ever done that. None. So, I got my hat for him. And we'll start this by asking what is energy. Because everybody talks about energy in Africa, energy. There's a difference between energy and power. What is energy? Even educated folks, they still confuse what energy and power is. Energy is different from power. Please turn the light up. You see what power is. Your place will do what? That. But is that energy? No. Energy is used to create power. And that's one of the reasons why most of the leaders don't get it. And why do we need energy in Africa? It makes good business sense. Anything you do, you need power. And power is driven by what? By energy. And I'm not going to go through all this for you. I mean, it's something that I wanted to highlight so you can see it. Because Africa is a mystical phenomenon. 1.1 billion living people in Africa. And we're still striving and talking about energy. Look at the global economic standing. The 7 biggest economy, I would say the top 10% growing economy is in Africa. Angola, Nigeria, Ethiopia, Chad, Mozambique, and Rwanda. Why is that? It's because they have what? They have a solid base energy in oil and gas and natural gas. Natural gas is one of the most contributing factors in development because you can use it to produce what? Electricity. So, 13% growing economy in the world. Where is Africa? Rwanda, Tanzania, Mozambique, Papua New Guinea, Cote d'Ivoire, Democratic Republic of Congo, then Ethiopia. So why are we having problem with energy? Okay? The aim of this presentation is twofold. Define energy, provide an overview of energy and power, and highlight the big environmental impact of energy. Because we draw to produce this energy, but what is it contributing back to the environment? You want to use energy for what? To power your home, the industries. But what are the impacts? Like I said earlier, energy is not power, power is not energy. Energy is used to produce power. But it's any natural artificial resource, renewable or non-renewable, that cannot be created. You cannot create energy. It's natural. I don't know anybody who can create oil and gas right now. It's a resource that was created long time ago, and once you use it, it's depleted. But you can use oil to produce power. The power can be in form of what? Electricity. We are enjoying it.
And the main thing I want to challenge us is the role of water in development. That's really my main goal. I think if I can get that across, then why it's important and why development usually cannot happen in a consistent way and in a robust way without water. So this is a quote from Kofi Annan. It says, the centrality of water, fresh water in our lives cannot be overestimated. Water has been a major factor in the rise and fall of civilizations. When we look at water in the world, and I want to point out specifically the issue of water scarcity. And we're looking, and we're getting very close to 2025. So this is a study that was done several years ago. And it says that about 2.8 billion people in what they constitute face water stress or scarcity concerns by 2025. mostly in West Asia, North Africa, Sub-Saharan Africa, and the Middle East. By 2050, countries facing water stress or scarcity will rise to 54. And in general, as populations increase, water stress will increase because more people, more demand for water. So water is key. And then we'll look at some of these statistics here. Except for Asia, so this is pointing towards Africa, then the average population growth is about 13%. Africa's population relative to the world is meant to be 20% by 2050, which should be about 1 billion. Okay? And in contrast, the US population in 2009 was 307, estimated for total in 2050, about 7% growth. Another issue here is the issue of water availability and water scarcity. Scarcity is at the heart of global water crisis, but it's not rooted in the availability of water. What that means is that water actually is available in African countries, except for the Arab countries, and I will show you the map for that. But the problem is that the availability of that water to the population is really the issue. So it says here that the crisis is rooted in power, poverty, and inequity, not in physical availability of water. Which means that this problem is solvable. It's solvable if it's addressed in the proper way. Okay, so it's not necessarily that you don't have available water. And then the other thing here is that we can correlate GDP growth with quality of life and available water resources. This map here shows, or this graph here shows, that when you have excess water, or when water is not available, the GDP goes up. And when it is not, it trends downwards as well. So it shows again the role of water. Okay, so poverty and access to water seem to go hand in hand in many African countries, especially in rural areas. And so that's where we need to deal with this. This is a very well-known statistic. So I just put it here. It's very well known, and I brought this up at one time. We're talking about Ebola, because you can, if you extrapolate this very quickly, you will find that as bad as Ebola was, the issue of water is a more critical one. Okay, so it says here, 2 million children die in developing countries from diarrhea diseases caused by unclean drinking water. So water access is a very important issue. And then the other side of water is that water is actually more expensive in developing countries than in developed countries. It doesn't seem to make sense, but that's the fact. This graph here shows how much water costs in New York, London, and how much it costs in Ghana and Colombia. Okay, so this means that one, it's because of the investment that goes into developing a robust water supply system. It's an expensive proposition. But then, even in the poorer countries, it is more difficult to achieve that. But the way I look at that is that this is opportunity. Okay? There's opportunity for us to do something, which means we need to engineer a solution that would provide water at a cheaper price. Now, when we look at Africa, we see this map that shows available water resources. This map basically shows the rainfall distribution. And you can see that in the greener areas here, you get more rainfall, and in the ones in yellow, you have more of the arid or low rainfall areas. Now, this map was initially developed really to look at areas where you can apply technologies like rainwater harvesting to supplement or to develop water resources, or at least to supplement available water resources. So the water issues that I see in Africa are these: water supply, access to water, and water quality. I think is a big issue. This is something that's often not highlighted because it's really a silent thing. If you drill a borehole and it contains a lot of chlorine, it's still water. People still draw that water. People still drink that water. They don't know what they drink. And it leads to all kinds of health issues. So water quality is a real issue, even as much as water supply. So you can't solve the problem in one dimension. Let's hope that solve the problem of supply. The problem of supply is not the only problem. It's a supply and also quality. Okay, so how do you address those together? Even when you capture the water, how do you know that water is suitable for the use that you would like for the use that's intended? The other one is infrastructure. We have a culture where, if you look at water infrastructure in this country, for example, the pipes in New York, they're about 100 years old. The pipe that runs from the northern upstate New York that brings water down to New York, they are huge pipes that have been developed many years ago. Are we willing, or can we change our culture so that we can invest with that foresight in the future? That's the challenge. How do we educate ourselves to say, this is going to cost this much, but the useful life of this is 50 years? I said, well, I've been dead in 50 years. Who cares? Okay, but you can't think like that. You cannot think like that. We have to change our culture. The culture of developing infrastructure that will last for a long period of time.
So what are the potentials in Africa? Sustainable and renewable energy, somebody spoke about that, I won't repeat myself. Hospitality and tourism. Hospitality and tourism. We're starved of good, efficient hotel rooms all over Africa. We're starved of reasonably efficient hotel rooms. The Marriotts are coming. The Radissons are coming. All sorts of hotel chains are running into Nigeria. I know a little British man who came to Nigeria to do one feasibility study for hotel. He ended up being about 50. In fact, he stayed in Nigeria. He's not going anywhere. Just doing feasibilities for hotels. I know him personally. He did a feasibility for me also. Okay? Financial services. There's so much demand for this in Africa. So much demand for this. Our banking penetration is only about 20%. It is that about 80% of Africans who still do not have banking services. About 80% of Africans still do not have banking services. So any bank that you drop into Africa today will make a lot of money if there's no corruption. If there's no corruption within the bank or bankers, it will make a lot of money. We don't have any, we have some sophistry, but we don't have enough sophistry in banking. I'll tell you, MTN, a telecommunications company, came from South Africa to Nigeria. They thought that there was going to be a struggle to make money, but within 2 years they had broken even and they had made a profit. Today, they control almost 5% of the GDP in Nigeria, and they make enormous amounts of profits for all their shareholders in dollars and in naira. Citibank came to Nigeria also, and within 2 years they had broken even and made a lot of money. Almost everything you drop into Nigeria or Africa, if there's no corruption and it's well managed, begins to do extremely well. Okay? Retail and consumer products. You'll be shocked that there's a lot of opportunity also in the retail industry in Nigeria. We're understaffed by any big retail chain, and there's a huge amount. At least in Nigeria, there's about 170 million people. A lot of them have never been into a good regular store before. What you have are little malams here and there who do their supplies. When ShopRite came to Nigeria, they couldn't believe what they saw. And within 5-6 years, they've opened almost 10 retail outlets all over Nigeria. And a lot of these South African companies are coming into Nigeria. There's a big gap in retail. What about waste management? Africa produces a humongous amount of waste every day. And from this waste, you can make power, you can make compost, you can make energy, you can make all sorts of things, okay? But the waste is just wasted because people do not know the value of even waste. We don't have good waste management abilities even in Africa. Ralph Monroe, God bless his soul, when he came to speak for me many years ago in my old church, as we're driving through Lagos, he looked at me and says, man, you people wasting a lot of money in Lagos. He said, man, everywhere I see opportunity, everywhere. He says, there's so much waste all over the streets. Why don't you start a waste cleaning company to take the waste away? He says, no, but you don't have street lights. Why don't you go and do some street lights? Third, you don't have street markings. He says, everywhere I see one, I see too much money. Okay? He saw everything that we living in Africa couldn't see. And a lot of people come into Africa and see those things. So there's an enormous amount of waste management that is possible in Africa. As for agriculture, I cannot begin to talk about agriculture. Maybe I should go into the slide itself. Opportunities in waste management, okay? Between 2010 and 2035, the urban population is expected to more than double from 298 million to 697 million. By the mid-century, over 1 billion people will live in urban areas. Public authorities cannot cope with this amount of waste. Somewhere in Ibadan, they have the cows to kilowatts project, where the plant generates an equivalent of 0.5 megawatts of electricity daily, becoming the first plant to do so. This sort of potential is available in Africa. Opportunities in agriculture. Only 5% of grain consumed in Africa comes from African farmers. Yet, we have vast amounts of land to do this sort of grain. But we import wheat, we import corn, can you believe that? We import palm kernel, palm oil. And guess what, okay? The palm kernel that we import in Africa from Indonesia was actually seedlings taken from Africa, sent to Indonesia. They started their plantations, and today we're importing palm oil from Indonesia. Can you believe that? Can you believe that? The same thing with cocoa. I was reading on the plane, a family somewhere in America that does chocolates, okay? And this and that. But there's not one cocoa bean being produced in America. Every cocoa comes either from Brazil or from West Africa. Yet there's not one cocoa or chocolate making apart from Cadbury in the whole of Africa. Only Cadbury makes chocolates. It's unbelievable.